So in neurologic disorders, we frequently categorize diseases based upon what we presume to be their underlying pathophysiologic activity. And so disorders can be divided up into being immune-mediated or degenerative or due to a toxicity or a traumatic type of an event. However, we understand that these different types of pathogenic features of a disorder overlap with one another. When we typically think of an autoimmune disease, we typically think of the immune system attacking our own tissue and thereby causing tissue injury, damage, and then symptoms. However, when we look at that tissue under the microscope and look to see what those pathologic features are, not only do we oftentimes see the inflammation or the immune activation itself, we often see markers of abnormal metabolism. This pathologic finding is, of course, curious because our disorders are typically not categorized as being immune and metabolic. But as we look at disorders in greater detail, we see that there's a great deal of overlap. Trying to understand how the immune system and metabolic dysregulation can coexist and co-contribute to a disease state is something that is quite fascinating. In neuromuscular disorders, we frequently take care of patients that have autoimmune muscle diseases, the so-called inflammatory myopathies or myositis. There are types of myositis where we have observed, and others, that mitochondrial pathology is as prominent a feature of those conditions as any frank inflammatory or immune markers that we see on the pathology. So over the last number of years, we've been curious and have tried to investigate how does metabolism and autoimmunity interact to create a disease state. So this is an observation that had been made quite a number of years ago when inflammatory myopathies were first being categorized back in the mid-70s. And some of the early categorization of inflammatory myopathies had recognized that there are two broad classes of inflammatory myopathies that have mitochondrial pathology. The first class of inflammatory myopathy that has mitochondrial pathology is a condition called dermatomyositis, which is frequently seen in pediatric population, but then is also observed in older population, frequently in association with malignancy. A second class of immune or inflammatory myopathy is a condition called inclusion body myositis. This is a condition which is slow-moving, typically seen in an older patient population, but is also characterized by immune pathology as well as mitochondrial pathology. What's interesting is that these two different disorders respond very differently to immunomodulation. In the case of dermatomyositis, patients frequently do very well in response to immunomodulation, where in the setting of inclusion body myositis, patients do not do nearly as well, suggesting that although the pathologic features may have some resemblance to each other, what's actually driving the disorder may be very different. And so using these two disorders as case examples, we can try to parse apart the difference between what the immune contribution is to the disease state versus what the mitochondrial or metabolic dysfunction is contributing to the disease state. So I think that's a fascinating question because most typically in disease states, we have thought of it as being a unidirectional relationship. But it is becoming more and more appreciated that the relationship between the immune system and the nervous system is reciprocal, meaning that abnormalities in the immune system will result in neurologic disorders, for example, multiple sclerosis or demyelinating neuropathies would be an example of the immune system negatively impacting the nervous system. On the flip side, we also know that the nervous system plays a huge role in being able to regulate the immune system. So our autonomic nervous system will help control and attenuate immune responses by regulating how immune cells are being turned on and turned off in the peripheral immune compartment. The role of metabolism in all of this is, of course, an area of investigation. We don't fully understand that relationship, but we do know that the immune system, as well as the nervous system, are very attuned to what the metabolic state of an organism or a person is at any given point in time, and then how metabolism or dysregulation of metabolism can turn on or turn off the immune or the nervous system is an area of investigation.